Hi, everyone. Welcome to the Northeast Region WOCN Virtual Conference. I'm Bill with Rook Products, and via this YouTube live session, we are going to talk a little bit about our Rook family of products, and then we can chat about any questions you might have about indications for use and whatnot. So I know this is Sunday, high noon. This is live. If you have anything you want to chat, please go right ahead and do so. And with that, also, I want to encourage you to check out our virtual booth. We have a lot of clinical information, product literature, things of that sort, and also help with getting samples too. So I would encourage you to go to that. So with that being said, let's go ahead and get started first with our Rook Vascular Boot. So the Rook Boot has been successfully used by surgeons, interventionalists, and wound care for over 30 years. Rook Boots totally offload the heel. And to do that, we use what's called our Comfort Plus layering system. We have a gentle slope, and then we have a pillow top layer, and all of that together does a very nice job of providing total heel offloading for your patient. We also are able to set ourselves apart because of the synthetic fleece material that we use. We provide natural warmth to the patient, and with that warmth, that gives your patient a vasodilatory cascade and a significant boost in regional distal perfusion. We also have a Mayo Clinic study that demonstrated a 5.3 millimeter increase in mercury in TCPO2s with Rook Vascular Boots. Now, I've learned that 30 to 40 millimeters of mercury measurement in TCPO2s is needed to properly heal a wound. So that 5.3 millimeters of mercury that you get from the Rook Boots, that's a significant percentage of that 30 to 40 that you're looking for, roughly 13 to 17%. And Rook Boots are an easy, non-invasive way to get a big chunk of that needed TCPO2 right out of the gate. So Rook Boots are one size fits most. You can wear it on the left or the right side. There's a grippy bottom to help with ambulation. We have numerous cutouts and a buttonhole opening that you can run SCD tubes through, a vac line. It also comes with an anti-rotation wedge that you can place on either side to help keep everything lined up just the way you want with your patient. And we also have these wings. These are adjustable wings that are used for foot drop prevention. You can move them around and get the right amount of tension that you need. So physical therapy has told me that if you ever anticipate having a patient bedridden, immobile for 3+ days or so, I would strongly encourage you to wear Rook Boots with the wings set. That's going to help prevent foot drop. Now, this is not going to correct existing foot drop because tone is always going to win. However, it does an excellent job of prevention in that manner. So I want to share with you some other indications for use, and to make sure that I stay on point, I'm going to look at my list here, okay? So Rook Boots are also great for your patients that are on vasopressors. Does a really nice job of that. And also, of course, your ECMO patients, IABPs, your post-BKA contralateral foot, your post-op open and endo-revascularization patients as well, and also arterial thrombolytics. Does a wonderful job there. Of course, in your world, Rook Boots are great for the prevention of heel ulcers and also to prevent that foot drop that we talked about, especially for those patients that are immobile and that they have the non-blanchable heels and toes too. I'm sure you can think of the patients that you've seen with the cold mottled foot. Rook Boots really help out with that boost in perfusion. And also patients with diabetic neuropathy. Very good for that. Of course, your existing pressure ulcers, your lower extremity ischemic wounds, PVD, your spinal cord injury patients, any patients that you have undergoing therapeutic hypothermia. Those are all excellent indications for use that you can use your Rook Boots for. So, if you recall, I mentioned Rook Boots are great for the patients on vasopressors, and especially the ECMO patients. We know that ECMO patients have a very fragile profile regarding their skin integrity around their distal extremities, around specifically that distal point of the Achilles, right? So, as I mentioned, you know that Rook Boots totally offload the heel, they protect, and then they naturally warm the lower extremity, and that provides a significant boost in regional distal perfusion. The Cleveland Clinic, Mayo Clinic, and Abbott Medical Center successfully use Rook Boots with their ECMO patients. And we have some available data from Abbott, which shows that ECMO patients wearing Rook boots had only a 0.0068 skin breakdown rate. And that was one patient out of 145. And that was a stage 1 at the Achilles. Okay? So Rook boots are truly fantastic at reducing the risk of skin breakdown for your ECMO patients, your patients on vasopressors and those other indications that we talked about. Another supporting clinical study from Riddle Memorial Hospital, D. Foster, out of 50 patients and 100 limbs in the ICU with an inclusion criterion of a Braden score of 14 or below, a PAD diagnosis on vasopressors, an existing arterial pressure ulcer anywhere, and an albumin level below 3. So these folks really had a rough going here. These were not cream puff patients by any stretch of the imagination. These 50 patients that wore the Rook boots for the study showed a 0% incidence of heel-toe ulcers. And those patients with existing pressure ulcers, 66% of the stage 1s healed in 4 days, and then the rest by 12 days. 40% of the stage 2s completely healed in 9 days, and the rest showed marked improvement. And then of the 3 stage 3s and the 1 stage 4, pressure ulcer size was reduced 75% within 12 days. So all the clinicians involved in this study at Riddle, they attribute the success of the patient outcomes to, first off, the excellent care given by the staff, but also the use of Rook boots. Okay, so I want to stress again to you that we have a tremendous amount of clinical-based evidence and outcomes to very strongly recommend that Rook boots become a major component in your standard of care. So that's enough about Rook boots. Next product I want to show you, this is our Rook Vascular Mitt for your hands, right? So it also uses a soft, padded synthetic fleece material, and it also naturally warms the hands and the fingers, and that's going to boost regional distal perfusion. So the Rook Mitt is fantastic for your patients with Raynaud syndrome, your patients that are on vasopressors, patients with mild to moderate AV access steel, and of course, hand ischemia, scleroderma, any of your procedures, your digit reattachment procedures too. Fantastic. This also opens up with a long Velcro opening, so when it's on the patient, if you need to check and adjust arterial lines or just inspect the condition of the skin integrity, you can open it up this way. It's less disruptive to the patient by doing it so. You don't have to slide it off. So that's the Rook Vascular Mitt. So our next product, this is our Rook BK below knee amputation stump protector. It's a rigid dressing product. 3 key points that I want to leave with you. So it's great for contracture control of your patient. It also is going to give you a significant boost in regional distal perfusion because of the natural warmth that we're very well known for. And then, of course, the wonderful, wonderful protection that this Rook BK gives you, it protects the post-op BK wound site from a bump or a fall. Now, we have had 29 reported falls of patients that are wearing our device on their BK, and those 29 patients that fell, we had 0 cases of dehiscence. So it did a perfect job of protecting against that fall. And it also comes with a belt system to help keep everything suspended when the patient starts with their therapy. It does a really nice job with that. Now, some of you may have had experience with those BK patients in the past where you used a generic knee immobilizer type product. So I've been told by wound care that those knee immobilizers tend to put a lot of pressure on the patella, and sometimes that's a little too much and it affects the skin integrity and you get a little bit of breakdown. So knowing that, when we designed our Rook BK, we are using a patella pad with a lot of very comfortable, soft synthetic pile material. It's going to be gentle on the skin and not put any undue pressure on it. It does a really nice job of protecting the skin integrity there. So the Rook BK rigid dressing stump protector. And of course, we also have a protector, the Rook AK, above the knee amputation stump protector. We also use that synthetic fleece material to naturally warm the patient, get a boost in regional distal perfusion. Again, protects against a bump or fall. It does a really nice job with this. And we have a belt system that holds everything in place. You can be creative and do whatever you need to do with it. But just a fantastic product to help protect that post-AK wound site as well. So with that being said, those are our 4 main products. We know that we could be a tremendous help for you. We are known, our products are clinically proven to boost your patient's regional distal perfusion. We can do a nice job with that. And these products really should be part of your standard of care. So if you have any questions, if you want to talk about products, if you'd like to get some samples, maybe do a trial, please call me or text me. You can email me. So here's my contact information. I know it's in the virtual booth too. My email is bill@rookproducts.com. That's bill@ROOKE products.com. My number is 614-937-7165. And like I said, call, text me. If I don't answer because I'm talking with somebody, just leave a message and a good time to call you back. So anyway, I want to thank you very much. I hope you have a great rest of your weekend. I hope you got all your CEU credit that you needed. The sun is shining here in Columbus, Ohio. I'm at home in my sunroom broadcasting this, but we are live. So again, give me a message, shoot me a text or email, and I hope you guys stay safe. And I look forward to the time when I can get back and meet with you guys in person and help you out in that regard too. So thanks again and good afternoon.